Hi everyone, I'm Susan Winograd, the founder of Pelvicore Rehab and Wellness. And here we help men and women with pelvic floor issues, bowel, bladder, and sexual dysfunction. But one thing that I really want to talk about today that is really not discussed enough is penile pain in men. Typically what happens is I will have men that come to the office and they are having pain either on the tip of their penis or in the shaft of their penis. This could be a burning, a shooting, a warm sensation, or a sensitivity on the tip or the shaft of the penis. Now, very often, most men have seen multiple doctors. They've gone to urologists, they've had urinary analysis done and cultures. Many of you have already had cystoscopies, which are bladder tests many times, and typically everything comes back negative. But you're still feeling that pain on the tip of your penis. I actually have a lot of men who have to end up wrapping their penis as they go through their day because it's painful or it's super sensitive. Now, here's the thing that I want you to know. It's very hard a lot of the times for my clients to wrap their head around the fact that this could be a pelvic floor issue. They always say, how could it be that the muscles in my pelvis are causing a pain on the tip of the penis? And I think, or on the shaft of the penis. And I think in order to really wrap your head around this, you need to understand the anatomy. So the pelvic floor muscles are a group of muscles that lay at the base of the pelvis. So this would be almost as if you're looking down into your body at the base of your pelvis. These muscles are hammock shaped, they're dome shaped, and they go all the way from your pubic bone all the way back to your tailbone and from side to side. These are the deeper muscles, which also have a lift mechanism, but more superficially, all of these muscles, these superficial pelvic floor muscles, are responsible for ejaculation. They have to contract, but also relax in order to have optimal sexual function and appreciation. Now, very often, what happens is when these muscles become tight, tense, or overactive, they do not allow the pelvic floor muscles to lengthen or relax the way that they're supposed to and cause pain in the tip or the shaft of the penis. Many times, this can be referred pain, meaning a muscle deep in the pelvic floor is referring pain to the tip of the penis. So it is a musculoskeletal problem. The other thing that we see very often is when a nerve called the pudendal nerve, particularly the dorsal or the penile branch of the pudendal nerve, becomes irritated, or the muscles are too tight and they don't allow that nerve to slide and glide. Many men report pain when they have an erection, they have pain when they ejaculate, or post-ejaculatory pain. And this could be because when you do have an erection, that dorsal branch of the pudendal nerve needs to lengthen. And that is totally normal when your pelvic floor muscles are healthy. But when your pelvic floor muscles are overactive, tense, or tight, it can cause increased pressure and tension on that nerve. The bottom line is that if you're having penile pain, sensitivity, or pain on the tip or the shaft of your penis, you're not alone. This is actually way more common than you think. And I know this because I'm a pelvic floor physical therapist who specializes in men's and women's health, and I help men overcome this all the time. And I will tell you that 9.5 out of 10 times they think they're the only ones, but you're not. You're not the only one struggling with this, and I want you to know that there is help. A great pelvic floor physical therapist can not only help resolve your symptoms, they can also help you identify the root cause of what's going on and help you resolve it so that you can live your life normally and enjoy and appreciate your sexual health. So this is Susan Winograd. If this video resonated with you and if it was helpful, make sure that you subscribe so you don't miss any other amazing videos. And please be sure to comment. I'm happy to answer any questions you have. But remember that you're not alone. This is something that I see and help people with all the time. There is help out there. You just have to seek it out.